Welcome to this explainer. Okay, today we are going on a really fascinating journey, especially for those of us who have, maybe felt a bit abandoned by modern medicine. We've all heard of the ozone layer protecting the Earth, right? But what if I told you that this exact same gas is being used by high-end detox clinics, top regenerative doctors, and even pro athletes? And they're using it to heal amputee-level wounds, reverse nerve pain, and completely supercharge the immune system. It's wild. We're going to explore the incredibly compelling science of activated oxygen healing.
Let's be honest for a second. Modern medicine is absolutely incredible, but it really struggles with chronic conditions. If you're desperately seeking help, we know exactly how terrifying it is to hit a dead end. I mean, when traditional antibiotics fail against terrifying superbugs like MRSA, or when those heavy painkillers just stop working for severe joint and nerve pain, it is devastating. So often we're told our only remaining option is some drastic surgery, or worse, an amputation. Because at a cellular level, our bodies are essentially running out of energy. They're struggling to use oxygen properly and failing to clear out systemic inflammation. We are looking for actual relief here, and that is exactly what we're exploring today.
Section 1. What is medical ozone? Let's dive right into this.
To understand how we can actually reverse these seemingly impossible conditions, we first need to define what this miracle-sounding treatment really is. Because let's face it, the word ozone carries a lot of baggage. We've got to explicitly separate atmospheric smog from medical ozone. Smog is the ozone you hear about on the news, the stuff created when the sun interacts with pollution, heavily diluted with nitrogen and other junk in ambient air. We definitely, absolutely do not want that in our bodies. But medical ozone, that is completely pure. It's produced by passing high-grade pure oxygen through a specialized clinical generator. The machine literally strikes that pure oxygen with energy, splitting the O2 molecules apart so they reconnect as O3. That right there is activated oxygen. It's highly unstable, and it acts as a very powerful oxidizer.
Now, you might be thinking, wait a minute, isn't oxidation a bad thing? Isn't that like rust eating away at a car? Well, here's the catch, and it is a beautiful piece of biology. Inside the body, ozone triggers a biological phenomenon called hormesis. Hormesis is basically a controlled stress that forces adaptation. Think of it exactly like exercise. Lifting weights causes micro tears and stress in our muscles, right? But our bodies adapt, they rebuild, and they grow stronger. When low concentrations of activated oxygen enter the body, it creates a mild, controlled oxidative stress that acts like a massive workout for our cells.
And this brilliantly illustrates how that mild stress cascades into massive internal benefits. It signals our cells to just pump out huge amounts of protective antioxidants like glutathione. It literally wakes up our immune systems. It releases nitric oxide to expand our blood vessels and forces our red blood cells to deliver oxygen far more efficiently. Plus, it increases energy production by recycling NAD and NADH directly inside our mitochondria. For those of us feeling completely drained, it is literally flooding our starving, damaged tissues with the exact energy they desperately need to repair.
Moving on to Section 2, Healing Wounds and Infections. Let's look at severe, life-threatening wounds and stubborn infections that traditional antibiotics just cannot seem to fix. For a patient facing a terrifying infection, this number right here is a massive beacon of hope. 1 minute. Because ozone directly destroys the lipid coating of viruses and bacteria, it is highly bactericidal and antiviral. Clinical laboratory data actually shows that simple ozonated water can completely destroy MRSA. You know that deadly antibiotic-resistant staph infection that plagues hospitals? In just 60 seconds. Just 1 minute, and it completely obliterates the infection on contact. No way, right? But it's true.
So how is this actually applied when one of us is facing, say, a really scary diabetic foot amputation? Clinics use a procedure known as bagging. First, they place a specialized bag around the affected limb and seal it up. Step 2 is totally crucial to maximize absorption. They dampen the skin and the wound with wet gauze. Finally, in Step 3, they pump in a continuous flow of pure ozone gas. Because the environment inside that bag is wet, the activated oxygen dissolves efficiently right into the tissue. Patients who were literally scheduled for amputations due to bone-deep osteomyelitis have experienced complete wound closure in as little as 6 to 8 weeks using this exact simple method. It is a real game changer. It's truly life-changing.
All right, Section 3, Reversing Nerve and Joint Pain.
Now, what's really interesting about this is how it works for all of us suffering from debilitating chronic pain and severe joint degradation. Unlike a pill that just kind of masks our pain for a few hours, ozone targets the absolute root cause.
Look at peripheral neuropathy. Ozone triggers the body to create algopeptides to stop overactive pain signals. But more importantly, it actively stimulates the rebuilding of the myelin sheath, which is the protective coating around our dying nerve endings. For chronic joint pain, it drastically reduces inflammation, balances local pH levels, and flushes out stagnant lactic acid. And for regenerative medicine, like those really expensive stem cell injections into a spine or a knee, buffering the injection with ozonated saline provides a captive oxygen supply. It keeps those newly injected cells alive and boosts microvascular formation so the joint can actually finally heal.
And for systemic fatigue or total body athletic recovery, clinics use an incredibly effective process called major autohemotherapy. Here's how it works. First, they drop out a quarter cup of your blood. Then, they bubble the pure ozone gas through it in a specialized IV bag. Finally, they return that supercharged, oxygen-rich blood straight back into your veins. It floods the systemic circulation with so much energy and recovery potential that many sports authorities actually monitor it actively under their blood doping rules. It's that powerful.
Okay, Section 4. Is ozone therapy actually safe?
As a patient, it's totally natural to fear pumping a highly reactive, unstable gas into our bodies. So let me boldly state the absolute golden rule of ozone therapy right now. We must never, under any circumstances, inhale ozone gas directly into our lungs. Our respiratory system simply does not have the antioxidant defenses to handle it, and the gas will severely burn our delicate lung membranes. This is exactly why professional clinical setups always use specialized ozone destructors to safely eliminate any excess gas from the room air.
But when used correctly by a professional, medical ozone therapy has virtually no side effects and is incredibly low risk. The absolute safest application is always dissolving the gas into fluids, like sterile saline or our own blood, before it enters the body. Now, while some practitioners do inject pure gas, doing so carries a risk of causing a dangerous embolism, so fluid dissolution is absolutely the gold standard. Also, and this is a big one, I want to explicitly warn that ozone is highly contraindicated for anyone with a blood coagulation disorder, like hemophilia. This is because ozone naturally creates a hypocoagulation or blood thinning effect, so definitely keep that in mind.
That brings us to Section 5. Why isn't it everywhere?
Seriously, if this therapy is out there saving limbs and reversing nerve damage, why hasn't our regular doctor offered it to us? To answer that, we have to look at basic economics. Despite being heavily utilized in countries like Germany, Italy, and China, it isn't mainstream in the US medical system. And it all starts with this number, $2,000. That is the exceptionally low cost for a clinic to completely set up the medical-grade generators and oxygen tanks required to produce the gas.
Think about it. Once that initial setup is paid for, the actual cost of the pure oxygen consumed in a single patient procedure is literally pennies, because the gas costs almost nothing to produce, and, actually more importantly, because it is a naturally occurring molecule that is completely unpatentable, big pharmaceutical companies simply cannot monetize it. There is no billion-dollar drug patent to protect here.
And that economic reality explains so much for those of us trying to find care. While the traditional insurance-based mainstream medical system kind of ignores it because it can't be patented, it is an incredibly high-margin, near-pure profit service for wellness centers. Clinics typically charge around $250 per injection. This financial reality is exactly why, today, ozone therapy is widely available, but we have to actively seek it out through biohackers and private regenerative clinics. It's the whole shebang of medical economics at play.
So we end with this really provocative question for all of us to consider. Could activated oxygen be the exact tool we need to finally heal? If you're dealing with chronic pain, slow healing wounds, or simply want to biohack your cellular energy, this therapy offers a fascinating, science-backed alternative to just throwing your hands up and giving up. I urge us all to take action today, do our research, and take control of our healing journeys. If you found this explainer helpful, hit that subscribe button to keep upgrading your health and wealth with us. See you next time.